my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and
You said, I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Rehabilitation from Bangalore.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are live, and today we are before treatment live, and today date is 29th May 2023, and today with us Dilip Nath is here, and Dilip Nath is having puberphonia, a kind of voice problem, and he's not staying in India, he's staying in different country, and he's going to take online voice therapy. And in fact, in the future, we are going to do post-treatment live as well. So those who are watching this live, please subscribe our YouTube channel, press the bell icon, and don't forget to watch the post-treatment live as well. So in this live, there will be an introduction about me and our center, our YouTube channel, and you'll be listening Dilip Nath voice, and we'll be also talking about puberphonia, signs, symptom, cause, and treatment. And in fact, all the session of Dilip Nath will be giving online voice therapy. And if you have a curiosity how the voice will be after the voice therapy, so just please subscribe our YouTube channel and press the bell icon. And my name is Sanjay Kumar. By profession, I'm a speech language pathologist and audiologist, and I studied from AIIMS Delhi, and I did my Bachelor of Science honors in speech and hearing from All India Institute of Medical Science, New Delhi, and I did my Master of Science in speech language pathology from the University of Mysore. And my area of interest is treating voice disorder, but by profession I'm an audiologist also, so we do hearing testing and hearing aid dispensing as well as at our center. And our center name is Sanjay Speech Hearing and Rehabilitation Center, and that is located in Bangalore. And our YouTube channel name is SLP Sanjay Kumar Voice Therapist, and that we started in the year 2010, and from then onward we are creating awareness about the non-surgical management of communication disorder across the globe, and our client list are from all the continent of this globe, either online or offline they have taken the treatment. So Dilip Nath, just tell us what exactly problem you are facing, where you stay, why you contacted us. We are live at our YouTube channel.
Okay, so my problem is that people say that my voice is high pitched, that it's hoarse, and that people always say, "Hey, Dilip, did you lose your voice?" And I say, "No, it's been like that." So this problem has been with me since May of last year, so a bit more than a year now, and I saw your YouTube videos and I decided to contact you, and now here we are.
Okay, where you stay? Have you taken treatment, any treatment there?
So I stay in Beaufort, Georgia, and I went to go see a doctor before, and Also, they said nothing is, there's no problem in my voice box. And yeah, and now I messaged you.
Sure, and I'll be giving on the all the voice therapy session through online method, and we'll be correcting through by online voice therapy method only. And as I told you in the beginning of this live, I'm going to talk about the puberphonia, signs, symptom, cause, and treatment. So your age is 14, so it's a typical case of puberphonia. Puber means puberty, phonia means something related to the voice. So a voice problem which occurs during puberty, and it's called puberphonia. In that, what will happen? A boy whose age is more than 14 years or 14, 15 years, and he will be speaking in a childish voice. And before going into depth of this problem, first let's discuss about the normal speech production mechanism. Once we'll understand the normal speech production mechanism, it will be easier for us to understand the abnormal speech production. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cord. So once you put air pressure below the vocal cords will move like a string of a violin and guitar, and sounds will generate. And that sound we modify into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. So once we say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sounds generate, we modify that sound into different sound. In one sentence, there are so many words, in each word there are so many sound, each sound is own place, own manner of articulation. So it is little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. So if coordination among these muscles will not be there will be fluency problem. Of course, you are not having. In case of a stammering, that happens. If place of articulation and manner of articulation is wrong, there will be pronunciation problem. That is called misarticulation. For example, if you want to say the, tongue should come between the teeth, and you are putting your tongue somewhere else, so the pronunciation problem will be there. The th sound will not come in clearly. So this has happened, and in your case, what is happening here? Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So because of the vibration of the vocal cords only, sounds will be generating. And when we say or any sound, so there will be vibration and both the vocal cord will be coming closer together also. So during puberty, what happens? Vocal cord mass length increases due to a hormone called testosterone. So because of the testosterone, vocal cord mass will increase, length will increase, the pitch reduces. So before puberty, either it's a boy or girl, there is no much difference between the voice. But during puberty, or we can say after puberty, in case of boys, the vocal cord mass length increases because of the testosterone hormone, and pitch reduces. In people like yours cases, what happens? During puberty, the vocal cord mass length got increased. Now the vocal cord is ready to produce the low pitch voice. But because of your earlier so many years habit, you just use the high pitch voice, childish voice, you found difficulty to switch on to the new voice. So what you did unknowingly, or we can say that, to maintain your childish voice, now your vocal cord is this, and the mass length is like a normal person, as your earlier also we told. So what is happening here? Instead of vibrating whole mass and the whole length, to maintain your childish voice, what you did, you just vibrated thin edges of the vocal cord. Instead of vibrating whole mass and the whole length, you started vibrating thin edges of the vocal cord. So the vocal cord, which was actually a thick string of a guitar-like structure, will started behaving like a thin string of a guitar-like structure. When the guitar string will be the thin, the pitch will be higher. When the guitar string will be the thick, pitch will be lower. So in your case, I'm not going to replace the larynx and replace the vocal cord. So what vocal cord or larynx you are having, I'll just stimulate the whole mass and the whole length of the vocal cord with a certain vocal exercise we called by voice therapy, and your pitch will reduce. And this all the process I'll be doing with a certain instruction and by online voice therapy. And those who are watching this live, and if you have the curiosity, so about the Dilip Nath's, like his voice is going to be changed or not, please subscribe our YouTube channel, press the bell icon, and once we'll be doing post-treatment live, don't forget to watch. So this is the biophysics behind the problem. And I was talking about the sign and symptom. So like when the child is, any boy whose age is 14 or 15 or even more than that, and when he's talking on the phone, still people are saying ma'am, or even his voice is breaking, hoarse, it's happening. So it may be the symptom of puberphonia. So you should do the professional consultation, and the professional speech language pathologist will be guiding you, and they will be treating the problem. And so this is the sign and symptom, but you should not confuse with some other voice problem. Like in some cases, just for awareness I'm telling, in rare cases I can say that based on my textbook, I have not met those patients. If there will be problem in the testosterone hormone, then also we have seen, we can see the high pitch voice. In case of muscle tension dysphonia, phonatory gap, sulcus vocalis, so those people are having the history of vocal abuse. Sometimes the pitch will be higher. So all high pitch voice are not puberphonia. You should know that. And what is the problem? Based on that, we should start the treatment. So the consulting from a certified professional is very, very important in case of management of puberphonia or like any other communication disorder. So you should always try to filter out, especially if you are staying in India, who is a right professional or who is a healthcare quack or jhola chap kind of person. You should, before starting the speech therapy, voice therapy, or before taking those services, must try to inquire the professional from whom you are going to take services, from which college he has studied, what degree he is having, which year he got the degree, what is the full form of the degree. Just try to find out. And if you are not able to find out through the social media or his website, or he's not informing, so he may be healthcare quack. Because I have seen in my clinic, many innocent people will reach to those healthcare quacks and they will damage their voice vocal cord, and they will develop like a vocal nodule, muscle tension dysphonia, phonatory gap. So these are the story I am seeing. So my role here is to create awareness across the globe. Always take help from a certified professional having expertise in the voice therapy. Don't do self-treatment, because doing any vocal exercise for long duration without the supervision and in the wrong way may damage your voice and the vocal cord. And of course, you should not take treatment from the healthcare quacks. So this is the message I wanted to pass to the people, those who are watching this live. And I'll be now seeing the questions which I'm getting on this during this live. So yeah, the very common question what we get is, sir, where is your center located? So our center is located at Bangalore, and that is also mentioned at the Google map. So those who are watching this live, please refer the description of this video. You will find our website. On website you can click and you'll find the reach me option, where we'll be giving the email ID, contact number, and on Google map where is the clinic situated. And the another more common question we get in our YouTube channel comment box is treatment duration and treatment cost and expected outcome. So for that, we suggest the patient to call us. We do the perceptual evaluation, and then we give the information about the treatment duration, treatment cost, expected outcome. And sometimes we suggest patient to do certain tests. So, and sometimes without any test, just doing perceptual evaluation, and we'll understand what is the problem. So these are the information I wanted to share to the people, those who are watching this live. And if you want to see Dilip Nath's voice in the future after treatment, what changes happen, so please subscribe our YouTube channel and press the bell icon. So Dilip Nath, there may be some people, those who have joined newly, please tell us exactly what problem you are facing, since how long you are facing, and just tell us. We are live at our YouTube channel.
So my problem is that people say that my voice is high pitched, that it's quiet, and they say, "Did you lose your voice?" And I don't. Before I came here, I didn't really understand what the problem was, but Dr. Sanjay is saying that it's puberphonia, and I've been facing this problem since like May of last year, and it's still going on. So it's almost been a year now. And yeah.
Okay. And so I just want your, I need to talk more and more so that people can understand your voice problem. So what's your career plan? Tell something more about you, how you spend your time on Sunday.
Okay. I like to, so I'm learning Java coding, and I think my career will be like a programmer or an engineer, something along those lines.
Okay, and those who are watching this live, if you have any question, please write in the comment box, and we'll try to give answer in the next live also, if I'm not able to give the answer. So thanks, Dilipnath, for your faith on us, and we'll solve your problem. Thank you so much. Thanks for your faith.
Thank you. Thank you.
I will stop this live and